Dear audience, let me present my work with the aim to join to the united scientific effort to reduce the impact of COVID-19. My name is Ágoston Jánosi. I'm working in the Translational Pediatric Institute, and at the COVID outpatient clinic, I have weekly experience with the children affected by the infection. My vision is a world with established ground rules in fighting a pandemic, and my mission is acquire a deeper understanding of research methods, hence increasing my knowledge in pediatric care. A short overview of my project list here. There are 3 perspectives that we consider remarkably important. Firstly, we investigating the prevalence of asymptomatic infections for understanding viral transmission patterns. Secondly, we analyze the accessible data on TNF-alpha inhibitor therapy as a therapeutic option in COVID-19. And lastly, we could have a deeper understanding of COVID-19 by conducting an analysis of our prospective cohort. Let's talk about my first project. We are investigating the prevalence of asymptomatic COVID-19 in different pediatric age groups. A few words about the background, but I'm sure everybody is familiar with this topic by now. The symptoms of COVID-19 are similar in children and adults, but the frequency of the symptoms varies. Children are likely to have a higher proportion of asymptomatic infection than adults, therefore they have a key role in the transmission. Our aim is to investigate the prevalence of asymptomatic COVID-19 in different pediatric age groups. We examine PCR-confirmed SARS-CoV-2 infection in children because our hypothesis is that the prevalence of asymptomatic COVID-19 is higher in school age, 6 to 12 years of age children, than in other pediatric age groups. The systematic search was conducted in 3 databases. There were more than 18,000 records, and we included 156 articles to the final analysis. Let me show our results. The prevalence of asymptomatic COVID-19 in children is 45% in our huge database. This means almost half of the infected kids are asymptomatic in the normal population. If we examine the different age groups, the higher prevalence of asymptomatic COVID-19 in school-age children is striking. It is 65%. And the age dependency, risk ratio age dependency plot provided by the dose response analysis also shows that the risk ratio increases over time until a plateau between 6 and 10 years of age and then decreases. And this plateau was evident in all 3 of our analyses. All 3, the prevalence analysis, the risk ratio comparison analysis, and the dose response analysis also shows that same consistent result with that high proportion of asymptomatic infection in school-age children. We also examined the sex distribution, and the risk ratio is not significantly different from 1 in this population. The plot shows that how many times the male group has a higher risk for being asymptomatic than the female one. During the data extraction, we realized that due to the different screening strategies and protocols, we have to create subgroups for the most accurate analysis. Therefore, we created 7 groups in addition to the normal population, and the table shows the ratio of asymptomatic COVID-19 in each screening strategy and age group. Let me lead your attention to the 7th group with newborns from infected mothers. 69% of them were asymptomatic in our analysis, which is important if we think of the high number and wide scale of post-COVID cases and symptoms. A few words about the strengths and limitations. We created the first analysis with a huge number of articles from 58 countries, and it gave the possibility for subgroup formations. And the lack of uniform data reporting and different screening protocols were our main difficulties and limitations in the analysis. As conclusion, we highlight that half of all SARS-CoV-2 infected kids are asymptomatic, with the highest prevalence in the school age groups. It is possible to create recommendations for protective measures or targeted screening protocols, for example, in schools. Meanwhile, the regular forehead temperature measure could be ineffective or unnecessary there. We can highlight the importance of vaccination in children, and in the case of diversified symptoms and complaints, the history of asymptomatic COVID-19 should be considered. And there is a need for further investigations of predisposing factors as well. Here are our manuscript status. And with my second project, we are investigating the effectiveness and safety of TNF-alpha inhibitors as a therapeutic option in severe COVID-19. Because studies found associations between the rising level of TNF-alpha and severe COVID-19 cases. Hence, TNF-alpha blocking could be a favorable intervention on modifying the infection. So we aim to investigate the usability and safety of TNF-alpha inhibitors in severe COVID-19 cases. We included studies that conducted the analysis in a population with SARS-CoV-2 disease, and we accepted a population as a control group that only have standard of care without any administration of TNF-alpha inhibitors. Our hypothesis is that the administration of TNF-alpha inhibitors associated with better clinical outcomes in patients with COVID-19, and we would like to reach an improvement in COVID-19 therapy. The systematic search was conducted in 3 databases, and the selection process and the data extraction has been done. And lastly, we perform a descriptive registry analysis, characterization of COVID-19 in Hungarian children, analysis of 517 prospectively collected patients' data. There are still a lot of gaps in our knowledge of COVID-19, especially in connection with children. So our aim is to create a descriptive analysis based on our unique cohort. There are more than 500 included children with data from every inpatient day, and we also collected biological samples during the follow-ups as well. The 1-year follow-up has been completed, and the 2-year follow-ups will start in September. And now let me lead your attention to the main conclusion. We are investigating the prevalence of asymptomatic COVID-19 in different pediatric age groups. We also investigate TNF-alpha inhibitors as a therapeutic option in severe COVID-19, and we could have a deeper understanding of COVID-19 with our registry analysis. Thank you for your attention.
It's so important, regarding the first topic, it's so important to know the high number of asymptomatic patients in age of the elementary school from 6 to 10, due to reason it's the September, so starting the academic year, and the new variant of the COVID vaccination will come from the older group and after going down to this age. So it's a very important topic.
Thank you.
What would be your explanation for this asymptomatic manifestation of COVID-19 in the age of 6 to 10? Like, how would you explain this, or what do you think about this? Thank you.
Yes, thank you for the question. It's a good implication for research. There are different answers for this question, but they are not proved yet. Studies think that maybe children are more protected, or they get less symptoms because of the compulsory viral vaccinations given routinely in childhood, or the immune system couldn't aggregate the immune response for SARS-CoV-2. So there are different answers, and they are not proved yet, but it's a really interesting question.
May I have a comment? At the beginning of 2020, when the first wave was the COVID, everybody dealing with patients with inflammatory bowel disease was very anxious whether the treatment of IBD with anti-TNF-alpha is possible, or whether immunosuppression, which it could have been elicited, could influence a worse situation. And it turned out that the situation is just the opposite. And that was the reason that even in the Hungarian pediatric GI association published a short guideline which told that it's not justified to disrupt the treatment with anti-TNF-alpha. And now you try to prove on the basis of your meta-analysis that just this is the situation. So on the contrary, it was advantageous, even from the point of view of COVID, to use the anti-TNF-alpha. Yes. Okay.
This virus actually changes. And as it changes, do you see actually differences, I mean, in your studies, or does it affect actually? Because when this is getting to be maybe less and less serious, so there are more and more undetected diseases. So in your groups actually, the deviation will get wider. So do you deal with this, or how do you deal with this, and does it affect your kind of outcome?
Yes, we investigate the problem that there are a lot of variants. In our analysis, it's from 2020 and 2021, so subgroup by variants was not able to do, but with this methodology that we here developed, it is clearly easily create new analysis of each variant which come to us. So it's a need for every variant create this analysis after years.
Due to the little time you had, I didn't really get more information about the screening strategies. Can you please go back and tell us a bit more about what do you think would be most efficient, and if you've seen anything interesting apart from the newborns? Thank you.
Yes, we would like to create the most narrow and specific strategies that we can. Therefore, we created the normal population, which percent is the 65% in the school age group, and we created populations for hospitalized patients, like inpatients. They mostly preoperative screening patients. They were in the hospital, and they have a PCR test in the hospital. We also have the suspected and contact tracing. It's a really huge group. The most of the articles are in that group, because the screening strategy in the most of the countries was that have to create tests for children and adults if they have a contact or they have any symptoms, so they are suspected. And also it's important the family clusters, the household transmissions, where we examined that how many children can get asymptomatic infection in household. So I think they are the most important screening strategies.